All right, welcome to Dental Boards, and this is review series number 3 of Operative Dentistry. Uh, we've already posted series number 1 and number 2, so this is number 3. Make sure you review the first, excuse me, the first few series, uh, and watch this one. Okay. As I mentioned before, make sure you subscribe and click on the notification bell so that you can receive the notifications when the new series are added. Okay. All right. So let's continue the practice. All right. So question number 21. Bonding occurs primarily by what? A. Microchemical bond. B. Micromechanical retention. C. Chemical mechanical bond, or D, or the above. So how does bonding occur primarily? So bonding primarily occurs by micro mechanical, okay, retention. It's not chemical. All right. So our answer is B. All right. So make sure you understand the properties of bonding and certain type of bonding agents that you know. Okay. So question 22. Which of the following statements regarding caries risk assessment is correct? A. The presence of restorations is a good indicator of current caries activity. B. The presence of restoration is a good indicator of past caries activity. That is true. Yes, if you had the restoration means you had a cavity, right? The presence of dental plaque is a good indicator of current caries activity. No. The presence of pit and fissures sealants is a good indicator of current caries activity. No, you may have pits and fissures sealants, but you did not have any cavities. You're just protective. So our answer here, the presence of restoration is a good indicator of past caries activities. Our answer is B. Okay. So, question number 23. Calcium hydroxide is used for vital pulp capping because, so why is calcium hydroxide used in vital pulp capping? Okay. A. It strengthens subsequent restorations. That's false. B. It encourages dentin bridge formation. That is true. Calcium hydroxide encourages dentin bridge formation. C. It stops and prevents purple bleeding. That's false. Okay. And D. It increases bonding to restoration. That's false too. So our answer here is B. Okay. All right. So make sure you know the purpose of calcium hydroxide. All right. All right. So, question 24. Which of the following dental cements? We discussed the cements in the first video, the second video series, and this is the third video series, and we're still talking about cement. So make sure you understand cement properties. Okay. So which of the following cement has a too low initial pH, which can cause sensitivity? And here, actually, I forgot to remove the answer there. So the answer is F. Okay. So A, C, and D are correct. Okay. Zinc phosphate cement, zinc, the glass ionomer cements, they also have initial low pH. Okay. So the answer is F. It's already there. But this question is very important to understand the properties of cements. So make sure you know and understand them well. Okay. All right. So here are some properties of zinc phosphate cement. Okay. Zinc phosphate cement is the mostly widely used cement. Okay. That was well, in not I would say in the US probably not. Okay, because the times have changed. All right. But a long time ago, it used to be the most widely used cement. Maybe if you go outside of the US, then you may encounter that the zinc phosphate cement is still used widely. Okay, it is the standard used. Zinc phosphate cement is the standard used to compare other cements. It has high compression strength and it needs only to apply a thin layer. Now, the big problem with zinc phosphate cement is it has too low initial pH, which can cause sensitivity and does not chemically bond to teeth. Okay. In the second series, we discussed that also the glass ionomer cement has also initial low pH and can cause initial tooth sensitivity. All right. So if you prepare a tooth and there was no pulp exposure, you prepare a crown and there was no pulp exposure, and you end up cementing the crown, the patient comes back a few days later with sensitivity. It's not necessarily because there is any pulp exposure, but it could be the sensitivity from the cements that you're using. Okay. All right. So question 25. Which of the following is an appropriate action when removing cotton roll or the cellulose wafers? Here's a picture of the cellulose wafers. So you have seen this before. Okay. So how do you remove this? You have to be careful when you remove this. Okay. So A, do you air dry them with air syringe to prevent removal of the epithelium from the cheeks, floor of the mouth, or the lips? B, you moisten them to prevent removal of epithelium from the cheeks. C. So the C is part of the B here. Okay. So moisten to prevent removal of the epithelium from the cheeks, floor of the mouth, and the lip. And C here, dry the mouth well before removing them, or the above are correct. So our answer here is B. You have to moisten them. Make sure you put some water on them. Okay. So B is the answer. Because if you don't dry, if you don't moisten and you just pull it, you're going to cause an abrasive wound or laceration. Okay. You're going to remove the mucosa from the cheeks, the floor of the mouth, the lips. All right, and traumatize the patient. So make sure you're careful. All right, when removing these. Question 26. All right. So, which of the following is a characteristic of a class 2 amalgam prep? So, what we discussed in the previous video series, in the second video series, we discussed the amalgam preparation. Make sure you know our class 2 amalgam preparation really well. All right. There's no excuse going in the exam without knowing the class 2 amalgam prep. So you have to know it. So A, occlusal dovetail provides resistance to proximal displacement. That sounds right. Only buccal and lingual walls meet two surfaces at 90-degree angle, the bud joint. That's false. It's not just the lingual and the buccal. The pulpal floor is on an incline. That's false. And the buccal and lingual walls diverge. No, they're supposed to converge. So our answer is A. All right. Occlusal dovetail prevents resistance to proximal displacement. Okay. So make sure you know that. So as we mentioned in the previous series, the series 2, here again is the characteristic of class 2 amalgam preparation. All right. So all walls should meet two surfaces at 90-degree angle. They should be meet at the butt joint, okay? And the occlusal dovetail provides resistance to proximal displacement, and the proper flow is usually flat. So you have to know the class 2 amalgam preparation is critical, all right? So don't go in this exam without knowing these characteristics. And the backward and lingual walls are convergent occlusally. The axial purple line angle is beveled to reduce stress, or disbeveled for resistance form. And the reverse S-curve is on the backer, and this allows the wall to meet external two surface at 90 degrees. So this slide, very important for your review, okay? All right. So question 27, which of the following is correct regarding external preparation walls? All right. So external preparation walls must be obtuse, beveled to the direction of enamel rod to maintain enamel support by dentin, or must be parallel to the direction of enamel rod to maintain enamel support by dentin, or must be acute cavern surface margin to the direction of enamel rods to maintain enamel support by dentin, or none of the above. Okay, so answer here is B. So make sure you know the preparation of the amalgam. And the feedback is that the external preparation walls must be parallel to the direction of the enamel rods to maintain enamel supported by dentin. Okay, and the angle between the cable surface wall and the external two surface should always result in 90-degree butt joint, and you should not leave any unsupported enamel. Question 28. So which of the following is not a typical property of dental amalgam? So okay, so here the answer is already there. The answer is A. Okay, so contracts and expands similar to dentin. That's false. Remember, amalgam is a metal, so this one is false. Okay, so all right, so the here the feedback of dental amalgam properties, make sure you know them well. Amalgam has high compressive strength, okay, to resist occlusal forces. However, amalgam is brittle, so it has low tensile and shear strength. It has it is weak in shallow sections and requires bulk. Okay, it requires bulk. That's why it has to be a certain millimeters in depth. So 1.5 millimeter to 2 millimeters is acceptable. Okay, depth for the bulk of amalgam. It requires 90-degree cavern surface margin. However, amalgam has high creep. It can become deformed as a result of occlusal loading uh, being applied for a long period of time. Okay, it is corrosive. Okay, it tarnishes due to sulfides. It has high copper alloy. Okay, high copper alloys are less corrosive. So if copper is added to the amalgams to decrease the corrosive nature of amalgam. Now, amalgams are self-sealing properties. These are an advantage for amalgam. Okay, so these are side effects of corrosion. When there's corrosion, those corrosion products, they seal the margin. Okay, they fill the microscopic voids between the tooth, so they prevent micro leakage. Diffusivity, and so it transmits temperature changes to pulp. So you may have some sensitivity when you eat hot or very cold things. Now, amalgam coefficient of thermal expansion is that amalgam contracts and expands 3 times more than dentin. So they are not, it's not equal to dentin. Okay. So question 29. Which of the following cements is the most widely used and is a standard used to compare other cements? We discussed this already. It is zinc phosphate cement. Okay, so A is the answer. And the feedback on zinc phosphate cement, mostly why it's used. We discussed this already. It's the standard used to compare other cements. It has high compression strengths. It needs only to apply a thin layer, and the big problem is that it has initial lower pH, which can cause sensitivity. Okay. All right. Question 30. So which shade guide is a gold standard for shade matching in dentistry? Here, you have to know this one. So Vita Pan Classical, all right, is the gold standard. And the feedback, there's usually there's three basic concepts of dental shade guides. Okay, and currently there's Vita Pan Classical and Classical Kid products and Vita 3D Master Shade Guides. Okay, now Vita Pan Classical has been available since 1956, so it was and is still to some extent a gold standard for shade matching. All right, Vita Pan Classical. However, the primary requirements and logical order and adequate color distribution have frequently been listed as concerns related to the Vita Pan Classical. So you have to know these things, okay? So this is the end of the third series. Make sure you look out for the review series number 4. Okay. Good luck. Make sure you click subscribe. Click the bell so that you can receive the notifications for the upcoming videos. Okay.